Hello, and welcome to our podcast. My name is Christine.
And I'm Isha. Today we are going to discuss the prevalence of alcohol use in both Maryland and our university campus, and how raising alcohol tax aims to decrease our rate of alcohol-related incidents. Our team also includes our peers, Laura England, who helped us with video and audio editing as well as researching, Andrew Eli, who was our fact checker, and lastly, Elise McQueen, whose efforts towards producing this podcast was extremely beneficial.
We are also joined today by our special guest, Miss Madeline Moore. Miss Moore is an alcohol education counselor here at the University of Maryland. She is a part of the Health Promotion and Wellness Services at the University Health Center. She also specializes in behavioral health education and is passionate about community health, especially how policy decisions impact community health.
For years, underage drinking in the United States has been a major problem. Unlike several other countries where the legal drinking age is 18, the United States' legal drinking age is 21. This leaves several teens and young adults in desperation for alcohol. On a similar note, this drinking issue is only amplified by local rules and regulations. Maryland has amongst the lowest tax rates in the nation for alcohol. Mixed with desperate underage drinkers and normal alcohol consumers, access to alcohol is relatively simple and cheap. Additionally, within UMD itself, it is advertised in every dorm that 1 in 4 Terps do not drink. 1 in 4. That is 25%. Such shocking statistics normalize underage drinking and only add on to the problem. Instead of education relating to the negative impacts of alcohol, such as facts as well as tips to stay safe while drinking, such as pre-gaming with protein, is out for show in the dorms.
Easy access to alcohol can also prompt issues such as irrational thinking, drinking and driving, unwanted pregnancies, and several other issues. The solution seems relatively simple, as raising alcohol taxes is the answer. The case study dives into the logistics of raising alcohol taxes in Maryland. Furthermore, the aforementioned issues and consequences due to low alcohol tax rates is detailed. The study also examines how widespread misuse of alcohol and underage drinking is within the state of Maryland. Much efforts have been made in the field of raising alcohol taxes in the state of Maryland, but it is also important to consider that this issue is a work in progress.
The research documented within the case study works to highlight, number 1, that excessive alcohol use is a problem in the state of Maryland, and number 2, that increasing the state alcohol excise tax will not only save lives and alcohol-related societal costs, but will also bring much-needed revenue into state coffers. Here are some statistics about alcohol use in the state of Maryland. Alcohol is a leading drug problem among Maryland youth, with 43% of 9th to 12th graders reporting drinking in the last month, and 24% report binge drinking. Furthermore, alcohol is responsible for 1 of every 3 deaths of persons between the age of 15 and 20 in Maryland every year, and excessive alcohol use is responsible for approximately 1,278 deaths and 7,470 violent crimes in the state of Maryland every year.
Evidence also suggests that people increase their drinking when prices fall and decrease their consumptions when prices rise, including among problem drinkers and among the youth. There's also a correlation of alcohol taxes saving lives. For example, increased alcoholic beverage taxes and prices are related to reductions in alcohol-related problems such as motor vehicle crashes, liver cirrhosis fatalities, sexually transmitted diseases, male suicides, hospital admissions, and a variety of other crimes and public safety concerns. It should also be noted that Maryland has not raised its tax on spirits since 1955 and its tax on beer and wine since 1972.
Low alcohol tax rates within the state of Maryland prompt a plethora of issues that jeopardize both public health and public safety. Issues range from underage drinking to addiction and drunk driving. Combating these issues must start from increased education about this issue. This podcast works to educate listeners on this topic and details the consequences of having alcohol tax rates within the state of Maryland be so low. With an increased level of understanding on this issue, the idea that Maryland alcohol state tax rates should be increased can be bolstered.
So the first question we had was, what are your thoughts on the causal agents?
Yeah, so first of all, thank you so much for thinking about kind of the root causes of why people may choose to engage in substance use of any kind, right? There are a lot of reasons why people choose to engage in substance use. Like, the list is truly endless and it is unique to each person. However, there are some overall trends, right? One of the trends that we see, especially on college campuses, is this internalized assumption that everyone engages in substance use. And you'll notice I'm not just saying drinking, because while alcohol is the most commonly used substance on college campuses, it's certainly not the only one, right? Like, we see cannabis, we see prescription drug use, not as prescribed. We see all kinds of things because we're a really big campus with a lot of people, right? So there's this internalized assumption that everyone engages in some sort of substance use in college, which is not true. Data suggests that roughly 1 in 4 students at the University of Maryland don't engage in any sort of substance use during their time here. And that's not to say there's a judgment on people who do. It just means that not everyone does. So I first of all wanted to highlight and focus on that a little bit. The second thing is that stress is a very major factor in a lot of folks' substance use decisions. Like, it is stressful to be a student. It is stressful to exist in the world right now. There are a lot of stressors that we all face. I also want to highlight that folks who face minority stress, so anyone who holds any sort of marginalized identities, may have some compounding stress based on their marginalized identity, like race, gender identity, sexual orientation, disability, etc. All of these things compound, and it's a lot to handle. So some folks choose to engage in like some self-medication through different forms of substance use. And again, I don't say this as a judgment on anyone. Like, my goal here, at least in my role as the alcohol and other drug program coordinator, is not to tell people what to do. Because I may be the expert on like substance use behaviors, but you all are the experts on your life and your experiences. So my real goal is like, how can we work together to figure out, like, meeting in the middle to figure out how to best support your well-being in ways that make sense for you. And I would say the third sort of like causal agent or factor is, in addition to this sort of internalized assumption that everyone is using substances and, self-medicating for different mental health stressors, including stress itself, is that at least alcohol and a lot of other substance use is like pretty widely available and not that hard to get, right? Like, there are certainly a lot of factors in place to try to mitigate folks engaging in substance use that's harmful, but college students are smart and you're creative and you find a way. And there's a lot of, like, I'll speak to alcohol as an example. We have so many liquor stores within a 5-mile radius of campus. It's like bananas, right? So there's just a sheer quantity that it makes sense that, like, if it's widely available, people are probably going to be more likely to use it. So in terms of causal agents, I think those are kind of the top three. And I would say in response to all of them, that all of that is learned behavior. And just as we learn substance use patterns, we can also unlearn, right? Or we can reprogram or recalibrate in ways that better enhance our well-being. And that sometimes means not engaging in substance use anymore at all. And sometimes that means practicing some harm reduction strategies to maximize the benefits that you're looking for and minimize the risk of harm.
That was a really interesting perspective, and our podcast also deals with how like Maryland has like amongst the lowest alcohol tax rates in the nation, which is why it's so accessible. So it was like interesting hearing how your perspective tied in with that.
Could you speak about your experiences or the specific trends that you're seeing within our own university?
Yeah, I can speak a little bit to it. I will name that the pandemic has really thrown a lot of our data. So a lot of what I'm saying may not necessarily accurately reflect the current usage trends because we don't have that data yet. But I mean, we know that alcohol use is like the number one most commonly used substance on pretty much any college campus. We know that our cannabis use rates have been steadily increasing, which kind of makes sense if you look at what's going on in terms of policy in our neighboring sort of areas, with Maryland, DC, and Virginia all enacting some sort of cannabis laws that are easing restrictions at a state level, right? So it kind of makes sense that folks are getting more and more access to these things, right? Like I said before, more access tends to mean higher use. I also think we see a lot of prescription drug abuse. You'll notice before I was using the term substance use because the term abuse tends to have some stigma attached to it. But the reason that I say prescription drug abuse is because lots of people use prescription drugs in ways that are prescribed to them as part of a care plan that's created between them and their medical providers, right? So not all prescription drug use has harmful consequences. But when you abuse it or misuse it, that is where we, like folks, as an example, like using Adderall around exam time to try to like stay awake and increase focus. Number one, the data does not suggest that your grades actually improve by abusing prescription stimulants. That's just not what the data says, straight up. But secondly, it can cause some really severe cardiovascular issues and can really impact your sleep and your long-term and short-term memory, right? So like, anyway, I feel like I'm going on a bit of a rant now. All of which to say, we see a lot of alcohol use, we see a lot of cannabis use, and we see a lot of prescription drug use among those who are using substances at Maryland. And I want to name again that is far from every student. But of course, in my work, I'm talking a lot about and with the folks who do.
So our next question is, what is a common misconception about underage drinking or alcohol abuse, which you can generalize to substance abuse, that you think is most contributing to like alcohol related incidents on campus?
Oh gosh. I know you sent me this question before and it's a hard one to answer. I think there are a couple things. Number one, I think there is an assumption among older adults that the only reason that college students choose to engage in alcohol use or any other form of substance use is to party. I know, and I'm hopeful that you all know that is not the case. Certainly some folks do, right? Like, let's call a spade a spade. Lots of folks are engaging in alcohol and other drug use for the purpose of partying. But there are also sorry, my bracelets are making a lot of noise. There are so many students who engage in substance use that is like potentially harmful to their well-being that are not using it to party and may in fact be using in isolation, right? Especially now where we're all feeling this increased isolation and loneliness. So I think that assumption by older adults can be harmful. I'm I'm generalizing. Certainly there are lots of folks on this campus who do understand the complexities behind this, speaking as an older adult myself. But I think just generally, there's a general assumption, especially among people's like parents and families too, right? I think another major thing is this, again, internalized assumption, right? This internalized assumption that everyone is using alcohol or everyone is drinking, everyone is partying, especially when we move back to an in-person environment where people will feel like they have to make up for lost time. There is also an internalized assumption that kind of dovetails that because you're a college student, alcohol use is not going to affect you, right? Like there is, and this is like proven, right? This is data, this is facts, but young adults, I'm thinking like folks between the ages of like 15 to like 25-ish, have this kind of superhero complex where because they're not immediately feeling the impacts of heavy alcohol use or other substance use, they think it's like, I got a hangover and that's it, right? When we know that there are actual long-term implications to heavy substance use. I'll use alcohol use as an example. Heavy alcohol use as a young person can contribute to long-term liver damage, which is not necessarily something you're thinking about when you're, ordering shots at the bar when you're 21, but you're gonna be thinking about it when you're 45 and you start having issues, right? So I think one of the things that's really cool about why that happens, sort of the root cause of why that happens, is because emerging adults, these like 15 to 25-ish range that kind of encompasses high school and college, this superhero complex kind of exists because you're literally biologically programmed to start breaking away from your family unit around that age. Thinking of ourselves as animals, right? Like this is around the time when you start like exploring what it would be to be an independent human and possibly creating your own families or family structures, right? So there's this huge independence factor and this huge boost in our confidence to like live in the world as we want. And that can be harnessed and be so cool and exciting and empowering. It can also lead us to believe that the decisions we make now will not impact us down the line. And that's just not true. So I would say those are kind of the two major things. This assumption by older adults that young people only use substances like alcohol to party, and this internalized assumption that the substance use we engage in now is not going to impact us down the line.
Okay, thank you so much. And our final question we had was regarding to Maryland policy and legislation. So in terms of our case study on raising the alcohol tax in Maryland, it's an ongoing struggle, and there are a lot of issues on both the supporters and the opponents of raising the tax. And the question we had for you was, what do you think the main issue with Maryland policy and legislation systems is what makes alcohol law so difficult to pass in contrast to other states?
I think any laws around substance use are hard to pass in general because there are such charged opinions about it. It's pretty hard to be someone who's engaged in any sort of community work, including politics, and not have some sort of opinion about substance use, including alcohol use. It's important to remember also that I'm a bit of a history nerd. So thinking contextually, Maryland was founded as a Catholic state, and Catholic ideals are still pretty rooted in our particular sort of state laws, including, as an example, like you can't buy alcohol on Sundays, right? That's not true in Virginia. That's not true in some other states. It is true in Maryland. And that's a relic of sort of our Catholic roots that has kind of just been kept because why not, right? So I think that's a complexity. I think another complexity is there's so much that goes into something like a tax increase. it's a lot of work, and it's a lot of effort. And frankly, there are a lot of priorities on the table. So I think sometimes, particularly because we do tend to have a little bit more restrictive alcohol laws than our peers, sort of in our immediate vicinity, I don't know this, right? This is an assumption that I'm making, but I'm making the assumption that kind of falls lower on the priority list than some other more immediate action items that the Maryland legislature is trying to push out. I will say, though, that so many people in my field are very big proponents of an alcohol tax increase. I'm not going to name my specific opinion because, frankly, it doesn't really matter very much, but I will name that is generally a pretty strong belief in folks who are in my field of like alcohol and other drug education on college campuses in the state of Maryland. It is a small but strong cohort, but there's been some advocacy work there too.
That was our final question, but we wanted to thank you for joining us today. I don't know about everyone else, but my perspective on this topic was definitely broadened, and I was super interested in what you had to say, but we wanted to thank you for taking time out of your day to talk to us.
Yeah, thank you so much for inviting me. This was fun.
Thank you, Ms. Moore, for your valuable insight. Whether we are discussing the impact of raising alcohol taxes on our university community or our state as a whole, it is clear that raising alcohol taxes is a beneficial public health intervention for everyone. At the state level, it is instrumental in addressing Maryland's high rates of alcohol-related incidents and bringing in profits to fund other public health interventions. At the university level, with the prominence of alcohol use on the campus, it's clear that this intervention could help influence and shape young adults' opinions and drinking habits. By not only addressing some of the causal agents, but also providing a potential solution to them, raising the alcohol tax is a step in the right direction to curb alcohol abuse and underage drinking. Despite the popularity and prevalence of alcohol use in the campus community, it is important to raise awareness and directly address the issues and the potential complications of underage drinking. Ultimately, we hope that through this podcast and public health interventions such as raising the alcohol tax, we are able to educate and inform our peers in their alcohol-related decisions going forward. Thank you.